Ladies and gentlemen, we will now conduct the question and answer session. Your first question comes from Wilma. Please go ahead.
Yes, good morning. I'm really enjoying this. I'm calling from British Columbia. My question is, if you're mentioning chemo, and I imagine you're talking about Taxol via intravenous, what about if you're on long-term oral chemotherapies, pills, say 10 or 11 days, as well as I have the peripheral neuropathy. Is that just as damaging to continue with the oral as, say, the intravenous? And another one is to address the cost. I just filled gabapentin and it was $98. So for me, it's not a problem. I can get this back through Extended Health. But for a lot of people out there, medication and the cost of it is something to be addressed. One more thing, sorry about that, is if any way possible, before we get the chemo, I had known about this, I would have been a lot more cautious to look for symptoms. I had no idea what was going on. I just thought, gee, there's something going on with my feet when I'm getting this chemo. But had I known what to look for, I could have addressed it sooner. Thank you very much.
This is Kathy. I'll take the question about the assessment. I think your point is very good. Certainly in our chemo teaching here, we tell our patients right up front that they may experience tingling and numbness and those sorts of things, and we assess it each visit to the clinic. Because I think it's critical that we know about that very early on, as Dr. Dawson and them said, that we can make an adjustment in the dosing. But if people are not aware that it's happening, as you said, there isn't anything they can do about it, and they don't know whether it's related to their chemotherapy or if it's something totally different. And going into the family physician, if it's someone who's not familiar with the side effects related to chemotherapy, then we could be weeks and weeks before we find out what actually is going on there. So I think certainly as an oncology nurse, I would highlight to my colleagues the importance of stressing that peripheral neuropathy is certainly a side effect not only of this kind of chemotherapy, but many types of chemotherapy.
Okay, thank you.
In terms of, this is Dr. Dawson, in terms of the oral, your question about oral chemotherapy, you know, it really depends which drug you're talking about. For example, often, and you may not want to say which drug you mean.
Oh, that's fine. I'm on etoposide.
Yeah, I have to say I'm not aware of peripheral neuropathy with etoposide. Though I will say, though, that that's hard to tease out because pretty well everybody who's received etoposide is receiving etoposide has already received carboplatin.
Exactly, yeah.
So
that was when I got it, first of all, was with the first round.
Right. So it would be very rare that we give that alone. I've myself not had anybody get worse on etoposide alone.
Okay, good. Thank you.
The only thing I would say is that certainly in the research that I've done, patients who've had cisplatin, the peripheral neuropathies tend to occur much later with them, and in fact, the neuropathies may not start for several months after the person has actually completed the platinum. That's not certainly the case with the taxanes, but certainly in the research that I've done, you can certainly get peripheral neuropathies that don't start for several months after they've actually stopped their treatment.
Yeah, no, mine, it happened right away.
Right away.
Also, if you don't mind, you mentioned this progabalin, that it hadn't yet been studied with the chemo. So would you say to hold off on asking to change to that, rather just stick with the gabapentin?
Well, we have, I mention it because we've certainly tried it in our pain clinic, when we only use it if gabapentin has failed.
All right.
And so most of the evidence with these types of drugs, gabapentin and pregabalin, are with gabapentin, and we always use that first. If it doesn't work or the patient is experiencing side effects, then we switch over to pregabalin. It doesn't always work, but it has worked in some women and some patients, and so we do keep that strategy. Unfortunately, you mentioned as you mentioned about costs. Both gabapentin and even in particular pregabalin are quite expensive. Gabapentin, now that it's been genericized, is a little bit better price-wise than it was in the past, of course. But pregabalin is a very expensive agent, and we would only use it when gabapentin has failed.
All right, yeah, and so you wouldn't worry about putting a patient on that and also on chemo as well?
No. No,
Okay,
not at all.
thank you very much, and I will let you go and answer other people's questions.
Thank you for the question.
Your next question comes from Patricia. Please go ahead.
Oh, thank you. I'm calling from Langley in British Columbia, and I would like to know the correct spelling of the drug that you're saying is going into the phase 3 trial that it looks like it'll be safe in humans and has benefits. Yeah, and to me it sounded like diazna or something.
No, dimesna. It's D-I-M.
N as in Norman? Or?
M as in Mary.
Oh, okay.
E-S-N as in Norman A. So that's dimesna.
Thank you so
You're
much. That's really all I need to know.
Okay.
Please go ahead.
Hi, I'm calling from Montreal, and I suffered as well neuropathy, mostly on my toes. I was given a medication called Lyrica from Merck Frost. Not from Merck Frost, sorry, from Pfizer. Do you have any research or any statistics or any information as to whether this particular drug has other effects that I should be aware of?
So I mentioned pregabalin, which is related to gabapentin. The other name for pregabalin is Lyrica.
Oh, so it is the same
Yeah,
drug.
so it is the same drug.
Okay.
I was just using what we call the generic or chemical name for the drug. But the Lyrica is pregabalin. And
Okay.
so, again, it's a good choice. We do go to it when gabapentin hasn't worked for us.
And earlier you had mentioned that there was, not you, but someone had mentioned that there is a therapy that stimulates the nerve endings. Can you repeat what that was? T something?
I think that was Kathy.
That was TENS is the easiest way. It's T-E-N-S.
Okay. And if I'm interested in trying this, what would I do?
Here in our province, it's usually done by the physiotherapist.
Okay.
They're in Newfoundland.
I'm in Newfoundland, yeah. It's I mean, I've been a nurse for 30 years, and I'm sure it's been used for 25. So
Okay, and it's called the TENS.
TENS, yeah. And it's,
So if I go to a physiotherapist,
yeah, if you want to look up on the net, it's just, you'll usually find it under the capital letters, T-E-N-S, and
Okay.
it's pretty, it's used a lot in pain therapy, and some people have found it to be very beneficial, not only for neuropathies, but for other kind of pain as well.
Okay. Okay, thank you.